Greetings, I'm Dr. Dan Fortenbacher, founder of Wow Vision Therapy, and it is my pleasure to welcome you once again to our 5th episode in our series of the Luminary Program, brought to you by Wow Vision Therapy, dedicated to advancing awareness and understanding of developmental vision and neuro-optometric vision rehabilitation. So in this episode, we're going to be presenting on the topic of vision and learning, why visual skills impact academic readiness. Presenting with me today is Dr. Alyssa Parz, our Grand Rapids partner and clinic director, and Dr. Alicia Bultsma, our St. Joseph clinic director. So in this episode, you could kind of think of it as part 2 on the topic that began in our 3rd episode, where Dr. Carl Hillier so eloquently presented some of the building blocks in understanding the fundamental definitions of vision and learning. In this episode 5, we are going to dive into some of the specifics so that the viewer will gain more understanding, including research about what we are describing and some of the very basic yet effective vision screening techniques that can be easily administered. This will provide you with a much greater insight about your child's vision and how it could be impacting their reading and learning. And for that matter, it applies to adults as well. Mm-hmm. So we're also going to provide some patient case examples. But before we start, doctors, what are your thoughts on the importance of understanding how visual skills impact reading and learning?
Yeah, I think it's really important for all these parents out there to understand that when their child is not meeting potential, that there could be an underlying visual component. And even though these parents are trying absolutely everything, encouraging their kids to read and catch up on homework, there can be a struggle that is visually related that needs to be detected and taken care of.
Yeah, I agree. And I think too, developmental optometry is such a huge piece to the puzzle when a child's struggling with learning. And so frequently we'll see patients that, have already been diagnosed with dyslexia or attention and concentration. And, I really feel the next step then should be, let's evaluate, is there a developmental vision issue that's also making that more challenging? Our field, we've never said we treat dyslexia or ADD, but we know, and you'll see in this presentation, what the research tells us, that there's a much higher prevalence of binocular vision dysfunctions in kids with those diagnoses. And if we can be there to provide those tools in their toolkit so they're not losing their place or seeing double or their print getting blurry and moving around, then when they go to their academic supports for reading, which are equally important, I think it'll be more successful. And that's really what we're trying to do, is set them up success-wise for the future. So.
Very good point. So with that being said, why don't we get started, and I'm going to begin sharing the presentation. So our topic, of course, is vision learning, why the visual skills impact academic performance. And one of the things that I wanted to touch on is a clinical practice guideline that was put together by the American Optometric Association a few years ago. And it's really quite a very thorough document that covers all of the various elements of various diagnoses, the research, some of the protocols, some of the best clinical practices with addressing learning-related vision problems. But one of the main things to emphasize is the mission that they pointed out in this paper, and that is the mission of the profession of optometry is to fulfill the vision and eye care needs of the public through clinical care, research, and education, so that all can be enhanced with the quality of life. All of our patients can have their quality of life enhanced. And so with that in mind, we are thinking about the relationship of vision as it impacts the quality of life. Moving this a step forward, the AOA and the American Academy of Optometry put together a joint policy statement about 10 years ago on vision learning. And some of the key bullet points here have to do with, 1, vision problems often interfere with learning, and that those at risk for a learning-related vision problem should be evaluated by an optometrist. The goal of optometric intervention is to improve visual function and alleviate associated signs and symptoms. The point of this also is prompt remediation of learning-related vision problems enhances the ability of kids and adults to perform to their fullest potential. So those with learning problems also require help from many disciplines to be able to meet their learning challenges they face. It's a collaborative model. Optometry is one of the professions that should be involved in the multidisciplinary management to prepare the individual for lifelong learning. So that's an important thing to keep in mind. So, but even with that in mind, this whole category of vision and learning can be confusing. It's confusing because a lot of times we see children who have behaviors that are already lumped into a particular category or umbrella of diagnoses, such as ADHD. We see a child with ADHD, so the thought is, well, where does vision fall into that? Or what about a child who has a diagnosis of dyslexia? I mean, dyslexia is a reading disability. So how does vision really impact that? So this is an important area that oftentimes leads to confusion, and oftentimes some of these children that could be having problems are swept under the rug because they have been determined to have these other broader diagnoses. But let's take an example. I think this is something we can all relate to. If we were to look at sports. So for sure, if you're going to be good in a sport, yes, athletic ability matters. It certainly matters. But if we were to take an example, let's take baseball. Visual skills matter, wouldn't you say? I mean, certainly it's important to be able to see the ball, to be able to hit the ball. So visual acuity matters. But also, you've got two eyes, you've got binocular vision, and binocular vision also influences your depth perception. And if you don't have very good depth perception, well, it makes it pretty hard to have reaction time and properly make contact with the ball as well. Oculomotor skills is another way of saying eye movement or tracking skills. What do we say to the kids when they're at the plate? Keep your eye on the ball. And if you have trouble with tracking or oculomotor skills, well, it's certainly going to affect your ability to make contact with that baseball or catch a ball. Certainly then eye-hand coordination, that's an obvious one. Vision and balance, certainly that's an obvious one. Visual processing, they might say, well, what are we talking about? Well, visual processing has to do with a lot of different areas. We're going to touch on some of those, but one of them is visualization, being able to see yourself being successful in that sport or in that activity or in whatever the situation may be. So in the example I'm using here, all of these areas of vision impact baseball skills and performance. And the same can be said about vision for reading and learning. Vision is more than eyesight. It's more than acuity. Vision is a process, and good visual skills require the skillful input of visual information. Yes, seeing it clearly, but taking that information in, making sense of what you see, which is the processing aspect of visual information, and then tying it together with other sensory systems. So that integration of visual system with other sensory systems in order to make use of that information. So vision is more than acuity. So when we look at the patients, when we have a patient in our examination chair, a lot of times the doctor might want to begin with some of the more standard approaches of, well, can you see clearly? And that's sometimes the obvious one, is that they're complaining they can't see clearly. So obviously we want to begin with, are you having any trouble with that? But other common questions are eyes hurting, itching, do you have trouble with headaches, frequent blurriness? Are you having trouble with double vision? Now, the interesting thing that I think we'd all agree with, doctors, is that the majority of the kids that we see that have vision-related learning problems don't actually come in with this complaint, wouldn't you say? And a lot of times, the issue that is happening is below the surface, and unless the doctor is asking the right questions, this child, we may not be pursuing along a path of investigating what could be the cause of these things. So for example, it's important that we ask questions about that child's interest in reading. Do they like to read, or do they avoid it? And that's one of the things. You could have a child who has the ability to read, but they avoid it. They don't like it. How about their handwriting? Is their handwriting legible? Are they copying uphill and downhill? These are important areas to look at. Homework, is it a battle? Now, for a lot of the kids that we see, they're having struggles in the visual component. It impacts their ability to do their homework, and that becomes an emotional issue between them and their parents and just getting the work done. Frequent letter reversals are a very common theme of the kids we see, but also that poor attention and concentration, the ADHD-like behaviors, comes up a lot of times on the list of the kids that we work with, but you wouldn't know it unless you ask these questions. And with tests that the eye doctors should be doing, in addition to testing for the refractive state or the need for glasses and eye health, gets into the categories of eye teaming. You've got binocular vision, both eyes have to work together. There should be an eye focusing assessment, or that's called accommodative testing. And there's the oculomotor or eye tracking skills that are part of those three areas of sensory motor is a category it's often referred to, have to do with taking that information in. And then the visual processing testing is another aspect that is a part of the mix. So when we look at the big picture, visual acuity, in addition to comparing it to vision, certainly eyesight, very important. You want to make sure you can see the best you can see. 20/20 is typically the standard. But then when we look over at the right column here, we've got binocular vision, working the two eyes together, accommodation or focusing ability. There's the strength, accuracy, agility, the tracking area, the fixation, pursuit, saccades, the depth perception, peripheral vision, getting into visual processing like spatial relationships, being able to recognize a B from a D, a P from a Q, visual discrimination, being able to see subtle likes or differences, visual form constancy, visual closure, visual memory, sequential memory, figure ground. As we can see, there's a whole lot of areas of visual processing. And in the kids that we work with, it's not unusual for them to be maybe strong. They might be good in visual figure ground, like they can find an object in the background of clutter, like Where's Waldo or Hidden Pictures on a Highlight magazine, but they have difficulty with visual memory. They can't remember what they just saw when you take it away. So these are important areas of visual processing that also need to be evaluated. Looking at the integration piece to it, the visual motor piece, the gross motor, the fine motor, and vision and balance. Now, these are all part of what should be assessed when we're talking about a child who has issues going on with vision, learning, vision, reading. So unfortunately, a lot of times these kids are not recognized, yet these visual problems exist, and they affect a significantly high percentage of children ages 6 to 18. Now, what's also known from the research is it occurs equally among boys and girls, and it affects reading performance, and their learning is impacted. And certainly there can be behavioral issues, not only attention, but emotional consequences, a pretty common theme that affects their sense of self, and there can be frustration and anxiety. So typically the kids that we see in this population, they have usually mild or no significant refractive error. That's the other interesting piece to the puzzle. They oftentimes come in with the ability to see detail 20/20. So moving it into some of the position statements, the American Academy of Optometry wrote a position statement about 10 years ago. And one of the main points to a conclusion it came to was that students with learning and reading attention problems typically have several factors that impact school performance. Vision problems may be one of these factors and should be treated in these students. Treatment of the vision condition is not intended to cure learning disabilities. I think that's a key statement, ADHD or dyslexia. Instead, the treatment is designed to remove the obstacle of a visual issue that's affecting their efficient reading and learning. Timely identification and treatment of eye focusing and treatment problems can remove a potential obstacle that may restrict a child from performing at his or her full potential. So that's an important policy statement from the American Academy of Optometry. And I think moving it into research, I want to hand this over now to Dr. Parz to discuss some of the things that have been published. Dr. Parz.
Thanks, Dr. Dan. So this was a great study that was published, I believe it was 2018 that it came out. It was published in JAMA Ophthalmology, and it was titled The Frequency of Visual Deficits in Children with Developmental Dyslexia. You can go to the next slide, Dr. Dan. Who did this study? This is the list of doctors. It included an optometrist, ophthalmologist, some PhD docs, a really great group. And in the next slide, you'll see it came from Boston Children's Hospital, Department of Ophthalmology, which is at Harvard Medical School. And next. What they studied, so what this looked at is the frequency of visual deficits, and what they're talking about here in terms of deficits would include vergence, so eye teaming, accommodation, focusing, and tracking. So eye teaming, tracking, and focusing in kids with developmental dyslexia compared with typically developing readers. And you see throughout the paper, they refer to developmental dyslexia as DD and then typically developing as TD. So they had 62 kids aged 7 to 11, 29 had developmental dyslexia, and 33 were typically developing. And like we talked about, they looked at eye teaming, tracking, and focusing, and of course corrected any refractive errors that might be present. Next. So here's just a little outline, some of the key findings. And Dr. Dan, you can go to the next slide because I point those out here. These were the graphics for this study, and overall showing that patients with developmental dyslexia had a much higher prevalence of eye teaming, tracking, and focusing diagnoses. And I'll highlight here in the next slide, Dr. Dan, you can see in the graphic down below where there's the little colored circles. So out of the developmentally dyslexic patients, there was 29. There was only 6 that did not have a binocular vision, eye teaming, tracking, or focusing diagnosis. While the typically developing readers, there was actually 22 that did not have any eye teaming, tracking, or focusing diagnoses. So breaking that down further on the next slide here, this is the outline of the different areas. So ocular motor eye tracking, there was a 62% prevalence in patients with dyslexia compared to 15% in the typically developing group. Eye teaming or vergence, developmentally dyslexic patients had a 34% chance of having an eye teaming issue versus 15% in the typically developing. Focusing system, so accommodation, there was a 55% chance that the developmental dyslexics had an issue there, or they did have it. Versus typically developing was only 9%. So overall, this study shows that patients that have this diagnosis, developmental dyslexia, 79% of them also had an eye teaming, tracking, or focusing diagnosis versus 33% in the typically developing readers. And this is something that clinically we've seen for many, many years, but this study really put this in perspective with a great, very clearly defined study showing that there's this higher prevalence there. And this is what we're talking about when we say a patient, that already has been diagnosed with dyslexia, what's the next step? We should look at their binocular system because maybe they're also seeing double, words getting blurry, or words moving on the page, and we can eliminate that part of the struggle for them with vision therapy. So we want to do that because then that will set them up for success as they go into the very much needed academic supports and educational tutoring that will come later. So that's what, that study really supported. The other big area that we talk about is the prevalence of ADHD and with a binocular vision dysfunction. And I really like this graphic that I pulled from a great book called The Hidden Link Between Vision and Learning. And what this graphic shows is 15 out of the 18 symptoms of ADD is also associated with a binocular vision disorder. So it is very common that we hear patients, they struggle with attention and concentration, but really it's this underlying binocular vision issue that's just maintaining attention in the classroom really difficult because, these patients, it's much more difficult to stay focused on a task at near because their eyes are working, much harder than they should. So looking far into the distance, relaxing their eyes is easier, and then it looks like they're just not focusing in the classroom. It's one of the most common misdiagnoses with convergence insufficiency because there are so many overlapping symptoms. So going into the next slide. This just shows some of the research that we now know and have between convergence insufficiency and ADHD. So this study, it was called The Relationship Between Convergence Insufficiency and ADHD. This came out of Ratner Children's Eye Center at the Department of Ophthalmology. So it was at the University of California, San Diego. In this study, I just pulled a little summary here. It shows they reported an apparent 3 times increased incidence of ADHD among patients with convergence insufficiency when compared with the incidence of ADHD in the general population. So much higher prevalence in patients with convergence insufficiency. And another study here in the next slide. This one was the behavioral and emotional problems associated with convergence insufficiency in kids. And this one came out of, I believe, I'm just looking back, the Journal of Attention
Disorders, yeah.
Yep. And this one showed that following office-based vergence accommodative therapy, so vision therapy, kids with CI showed a significant improvement on the Conners 3 ADHD index. And because of that, that's why we track attention and concentration throughout vision therapy, because almost always we see at least a decrease in their attention and concentration behaviors as their visual system gets more stable. So it's something that we are tracking. On the next slide. Now, what can we do to help identify kids with vision and learning problems? So one is just looking for behaviors. This population of patients oftentimes are the ones that unfortunately get labeled in the classroom as just being lazy, they're distracted, inattentive, maybe have ADD or ADHD, they have a behavioral problem, or they're just acting out, they're kind of the class clown. So looking for these behaviors and saying, why are the behaviors happening? Are they happening, when the child's asked to sit down and read something or try to do math worksheets and they're losing their place or copy information down? So kind of putting together, when are these behaviors happening, so we can actually find the root cause. Next slide. And then the big three, I'd say, important questions, and Dr. Dan, you touched on this, but does your child avoid reading? Is it an enjoyable process or something that is their absolute least favorite thing to do? And if they say yes, they like reading, well, then going one step further and saying, okay, but do you enjoy reading when it's read to you or it's an audiobook versus if you had to read it yourself? Or do you only like to read graphic novels where it's lots of pictures and very few words to it? Because I think that's a really important distinction to make. Sometimes you'll hear a kid say yes, but oh, it's when mom and dad read me stories at night that they enjoy it. So just knowing that part of the puzzle too. Is homework a battle? Is it taking a really long time? Meltdowns happening every night? Do you have concerns about handwriting, paper pencil tasks where, words are getting all smushed together or they're losing their spot as they do it and, the size changes as they go? So those are probably the top three questions that we recommend be asked to children. And some symptoms to be on the lookout for. So in patients with this diagnosis of binocular vision issues, tracking or focusing issues, they lose their place a lot. They reverse letters, numbers, or words. They struggle with attention and concentration, poor memory, copy poorly, take a lot longer just to complete assignments, and letter reversals that are happening past the age of 7 is really what we're looking for in these cases. And one thing we always ask, so, a lot of times when you overtly say, do you see double, even patients that do have it will say no, because it becomes their normal. And so it's not something they're really even acknowledging that, is happening. So we use a lot of demonstrations to talk about, when you look at words, do they start to pull apart and split? And we kind of use our hands like this. Sometimes people explain it as they almost look 3D, or you're starting to see a shadow as it gets kind of blurry and is going double. And then in some of the brochures and things that we have too, we have these little demos that, we can easily say, does the print sometimes look like this as you're reading? And then we can easily show that to parents so they can understand what's happening as well. Additional case history questions. So I put on here a few different surveys that we use and questionnaires. These are all on our website I'll show you on the next slide where they're at. And there's varying detail in these. So on our website in the provider section, there's a list it says doctors and therapists, but really they're accessible to anyone. So anyone could be on the website to look through and just ask some of these questions to your child. Dr. Dan, if you go to the next slide, I think one of the most straightforward questionnaires that we have is just this reading and learning questionnaire. It's only 6 questions and you rate it on a scale of 0. This never happens to 4, always it's happening. And it's a really nice, just quick way to identify an issue. If you want to go further and have a much more detailed questionnaire, one of those other ones that are listed on the website is also available. Next slide. Other common symptoms. So a lot of times, these kids, they're smart kids. And so you can tell they're really smart, but there's this disconnect that's happening. Why are they struggling with this specific skill in the classroom? Even though talking to them, they're really verbal and, they have a great vocabulary, but it's not translating in the classroom. They really need to use their finger, a bookmarker, or one of the highlighter strips to keep their place. Their ability to read is worse as the print gets smaller. So in some patients, they can manage and get by until maybe like 4th grade when they tend to get into more chapter books and the print shrinks and now they start struggling. They also miscall easy words, things they know like this or the. And a lot of times, and I've been seeing this a lot lately, adopt an unusual head posture. They'll turn their head, tilt, or end up covering an eye because it's so difficult for the eyes to work together, and these postures eliminate that need. And then Dr. Dan, I'll hand it back over to you on the screening tests that can be done.
Thanks, Dr. Parz. That was great. It's a good explanation of some of the fundamentals that we need to be asking, questions that we need to be asking. And now what I'm going to demonstrate are a couple tests, a couple easy screening techniques, procedures, will help identify a patient who has a convergence problem or an oculomotor problem. And the first one we're going to do is called the near-point convergence test, and then we're going to do one that has to do with oculomotor pursuits. And what I'm going to do now is invite to the presentation our very own Jessica, a vision therapist. Jessica, I'm going to have you take a seat and join us. Thanks for participating in today's episode of the Luminary Program.
Thanks for having me.
Great. So one of the tests we're going to demonstrate here is a common one that can easily be done, has to do with measuring convergence, binocular convergence. And there's a couple ways to do it. Now, for clinicians, for doctors, one of the techniques that we recommend is the red-green pen light near-point convergence test, which involves red-green glasses and using a pen light. In this case, this is called a transilluminator, but basically it's a pen light. And what we ask our patient to do is to tell us when they see two images as I move this closer. So the point is, on this, we're trying to determine where they see double. And what is normal is it should be single up to about 2 to 3 inches. So if we do this with you, Jess, tell me when you see 2.
2.
All right, so that's at about maybe 12 to, tell me when it comes back to 1.
1.
So it's the break and recovery. You're looking at where you see double and where you can put it back together.
2.
Back to 1.
And 1.
And a third time. We do it 3 times just to get a sense of
2.
if they have trouble with it
1.
more over time, if it's a stamina issue. But if you don't have red-green glasses, and for parents that may not be practical for you, one of the things you can just take out is an ink pen or a pencil. And the same technique, and both techniques were done as far as applying them to the clinical research, the convergence insufficiency treatment trial. They used both red-green pen light and they used the pen on the stick, or a pencil rather, a pen. And we basically are looking at the same question. When you see 2 pens,
2.
back to 1,
1.
and back to 2,
2.
back to 1.
1.
Just to be clear, Jessica can converge to the bridge of her nose, but she's demonstrating what it would be like. And some of our patients are out here, right, Jess? Sometimes we see patients, they see double way out here, and that's definitely a big red flag. So that's a very basic test that would suggest convergence insufficiency or difficulty with teaming the 2 eyes at near, which affects endurance. And that's where we're looking at from some of the research that affects attention and concentration and can make words do this when you're reading. This next one we're going to do is to demonstrate eye movement or tracking skills. And again, we're taking a bead on a stick, but you could use a pen or a pencil. And all we're asking our patient to do is follow the bead on the stick. I think I'll have you come just a little closer so you can see your eyes a little better here, Jess. So looking at her eyes now, as I move this around, you can see the first part we do is just very basic. And you can see she can do that fine. What we're really looking at with the child is, can they do the tracking while you ask them some simple questions? Just simple things to ask them to think and track at the same time. So let's try this with you, Jess. Jess, what's your favorite color?
Red.
Do you have any pets?
Yep.
Tell me about your pets.
Her name is Tootsie, and she's a dog.
Oh, what's your favorite food?
Pizza.
What do you like on pizza?
Pepperoni.
Okay, so we're looking at Jess's ability to track, and notice how that was much more challenging for the children we see that have trouble in this area. And Jess did a very good job of performing that example, but they will have that same issue. They can track it basic if you just have them follow the bead on the stick, but when you ask some very simple questions, then they're having trouble doing that. And that should be easy for them also. And the other thing to keep in mind, if they're doing that on this example, they're having the same problem in the classroom with all the other distractions and noise going on. So those are 2 very basic examples of screening tests can help you identify a child with a convergence problem or an oculomotor problem. And there's a long list of other standardized tests that we do in addition to that. Thank you very much, Jess, for helping.
Thank you.
So jumping back into the presentation then, we're going to share this again and pick up where we left off. So again, the common diagnoses that we often see are convergence insufficiency. That's like what we were demonstrating with that near-point convergence test. Accommodative dysfunction, which is a focusing problem. That's a harder one to demonstrate in a video or a webinar kind of format. It requires testing by the doctor, but looking at focusing ability to look at near, sustain, and amplitude. That's a strength test, flexibility, back and forth, and accuracy. And then the oculomotor dysfunction. Now that test that we did, the demonstration, is a pursuit eye movement, but oculomotor dysfunction can also involve saccadic eye movement, the kind of eye movement we do when we're reading, which is actually involves a variety of standardized tests that we look at. So convergence deficiency, accommodative dysfunction, oculomotor dysfunction are three of the most common diagnoses associated with vision learning problems. So as far as also another key resource available for the public and professionals is the Vision Help Vision and Learning Library. So just go to visionhelp.com and you will find a wonderful variety of resources under this topic. Just look under vision learning and you can find evidence-based practices, examples of history forms, there's other videos, and a variety of materials available. So I'd encourage you to check that out. For more information, the visionhelp.com website. So let's talk about cases, shall we, doctors? Let's jump into describing a couple examples of patients that we've seen and treated.
Awesome. So I will go first. I have a patient who was 11 years old, and he found a way to our office because he was struggling with reading. He was a very capable reader, and as his mom had pointed out, he started out really strong with reading, but once he got to that chapter book stage, that's when things started to get hard, and he really avoided reading. Homework was a huge battle. The teachers were commenting that his behavior was changing in the classroom, and he was just really struggling in that area. I have a quote from him that he said he had to read the line so fast to catch it before it would turn double. So he was noticing the double and trying to just avoid and do everything that he could to stay away from having those symptoms and that reading component. He was also getting a lot of headaches, which contributed to what we were looking at. So if we look at the visual diagnoses going on, he had convergence insufficiency. On that red and green pen light test that Dr. Dan demonstrated, he saw double at 24 inches from his face and couldn't get it back to single again until it was 48 inches from his face. So pretty severe convergence insufficiency going on. He also fell in the category of accommodative insufficiency. He was really low with his ability to stimulate his accommodation. His oculomotor actually was relatively good for his age. He was testing at about an 11-year-old age equivalent on our saccadic testing and did relatively well tracking the bead. But the attention concerns were really strong with him on some of those checklists that Dr. Alyssa had mentioned. His symptom checklist was really high, and his attention checklist was also really high, filled with a lot of frequently happening and always happening. We did 30 sessions of vision therapy with him, and as he improved his visual skills, his enjoyment of reading started to come back. He was enjoying reading chapter books again. The behaviors had really decreased. He was such a fun and enjoyable guy, and he was able to really show his personality and enjoy reading much more effectively now that his visual system was in a better place and he was performing well in school and really just meeting his potential that the parents knew was there, but they couldn't figure out how to unlock it.
That's a great example. Thank you for sharing that story. Dr. Alyssa, can you tell us what about your patient?
Sure, yeah. So the patient that I'm going to talk about today, he was 9 years old when he started vision therapy with us. He was in 3rd grade. He was referred actually by one of our colleagues, a neuropsychologist. The parents sought out that evaluation because he was really struggling in school, specifically with reading. It turns out he was diagnosed with what that paper, JAMA, talked about, the developmental dyslexia diagnosis, also visual spatial challenges, and attention and concentration challenges. Why he was really in our office, again, when we asked that question, do you enjoy reading? He said, absolutely not. It's one of his least favorite things to do. He lost his place a lot, frequent letter reversals, struggled with spelling. He also reported getting a lot of headaches after completing schoolwork, and there was a lot of visual fatigue there. He was actually at the point, because of the headaches and fatigue, that the school stopped giving him homework assignments. So they accommodated for him because it was just so challenging and overwhelming for him. Our diagnoses, he had convergence insufficiency, ocular motor dysfunction, and visual processing delays. His near point of convergence test, the test that you demonstrated, Dr. Dan, wasn't quite as severe as your patient, Dr. Alicia, but he did see double at 12 inches, so still significant there, which impacted his depth perception, and I think definitely where his headaches and fatigue was coming from. His ocular motor testing, he scored at about a 7-year-old age equivalent when he was 9. And visual processing scores across the board were all very low for reversals, how well he could remember things, scoring in a 4 to 5-year-old age equivalent range. And his reading test was at about a first grade level when we evaluated that. So he completed about 35 sessions of vision therapy with us in total. And it was really neat to see his growth as we went through vision therapy on his progress checkups and goals. His mom brought me in one of the standardized tests that was used in his school called the iReady test. And within 4 months of, retesting on that specific standardized test, he went up over 45 points, which correlated to 136% growth over those 4 months on what his goals were for the year. So huge improvement there. By the end, teachers were all commenting how much improvement they were seeing with him in the classroom on reading, and he was getting more confident with his skills, and he wasn't getting headaches or anything like that any longer. His parents wrote a really nice success story for us, talking about how huge of an impact this was for him on all of his, life goals and just, challenges he was having when he first came in, that we featured in our online presence on social media and in our office here, because it was just really neat to see that amount of growth. And he actually then was able to refer other classmates of his that struggle with reading because they were able to see his success. So it was really neat that he was able to get other patients help by the end. And by the end with us, he was scoring at 3rd to 4th grade level on his reading tests now and achieved all of his goals. So pretty neat to see.
That's really excellent. And I think it's really a good testament to so many of the kids and adults we work with. They come in, they feel down, they've tried, but it's just not working. It affects them and their self-confidence. And I think one of the things that, for me, all these years in doing this has really been so much of what I've enjoyed about doing this is to see our patients blossom, to see them start to improve in their overall confidence and self-esteem. And I think that's in addition to obviously the performance side of things, that they're doing better. Wouldn't you say? I mean, that has a lot to do with what we see with our kids and adults.
Yeah, definitely the confidence huge. And I think just our relationship with some of our colleagues too, because, this is cases like mine, and I know with Dr. Alicia, it's a group effort. So, we needed neuropsychology to help identify the struggles. We needed vision therapy, but then we also needed him working with his reading tutors and reading specialists, which he did all throughout vision therapy. And I don't think we would have seen all those goals without all those, team members playing a really critical position. So I think it's, just a really important part that we're working together with all of these specialists to get the best outcome for these patients.
Very good. Well said. And I think with that being said, I think that's a great wrap. Thank you, Dr. Bultsma. Thank you, Dr. Parz, for all of your contribution to the presentation today, our 5th episode of the Luminary Program. And I want to thank you all, the viewers, for watching. Thanks again.